All right. Well, good afternoon. It only looks like we don't have very many people here because it's a very large room. So, like on the airplane, feel free to spread out. Put your purse on the seat next to you. I wouldn't probably recommend laying down, but if you really feel the need, we're going to try and get through this pretty quickly. So we have a list, and some RSVPs and some not. And so what I want to do is just go down the dais and have everybody introduce yourselves. And if you look right up by the base of your little microphone, that little red thing, push that when it turns green, your mic is on. And
Green.
And your mic goes off. So you want it to be green. So I will introduce Betsy Lowry, our Temecula wonderful staffer, and we'll hear from her a little bit later. So go ahead, Kim.
I'm Kim Garish, Executive Director, Michelle's Place Breast Cancer Resource Center.
Melissa Rada, Program Manager at Michelle's Place Breast Cancer Resource Center.
Kim Harris, Managing Editor for Valley News and Reader Media Group.
Cindy Davis, a Marketing Representative for Valley News Reader Media Group.
Julie Reader, publisher of Valley News and with Reader Media.
I'm Lisa Sobek, Mayor Pro Tem for the City of Menifee.
Marianne Edwards, your hostess with the mostest.
Darlene Wetton, CEO, Temecula Valley Hospital.
Carrie Bacon, Medical Director with IEHP.
Salome Waga, epidemiologist with Riverside University Health System Public Health.
Jonathan Skinner, oh, wow. Yeah, big mouth here. Jonathan Skinner, Director of Community Services from the City of Lake Elsinore.
Rich Piper, Community Relations, Menifee Valley Medical Center.
Evelyn Mendoza, I'm one of the local medical oncologists and the current Cancer Committee liaison for the Loma Linda University Medical Center Murrieta Cancer Program.
All right, thank you. And, in the audience, would you mind standing up and just telling us your name, just so we'll know and be familiar? Great. Wonderful. How come you guys are hiding in the back? Okay. Great, welcome. And we had somebody else. We don't let the press sneak into the room, so you got to tell us who you are. Thank you.
Got a spot up there.
Oh yeah, you have a place right here. Okay, so do we have any public comments? Do we not? Do we? Do not? I don't have anything up here, so. Nothing? All right, then we will move along to, I don't know if anybody out there, your patients, do you want to give a testimonial? We have a place for testimonials if anybody would like to speak. So this is the time. And if you don't want to speak, that's fine. We're just glad to have you here. So we can go on to item number 2, committee business. We have announcements, and I have Solomon and Darlene. So Solomon, want to go first?
Sure, I'd be happy to. Good afternoon, everyone. The Riverside University Health System Public Health, in collaboration with HARC, we actually submitted an abstract to the American Public Health Association 2018 Annual Expo, and the title was Regional Cancer Task Force, an innovative approach to assessing and addressing a need for services and treatment options.
Right.
It's my pleasure to say that the abstract has been selected from a large number of excellent submittals for an oral presentation. Their words, not mine. For oral presentation. So that will take place in the city of San Diego this November. It'll be on Wednesday, November 14th from 12:30 to 2 p.m. And the category that it is under is actually entitled Addressing Chronic Disease Inequities Through Collaborative Partnerships. And so we're hoping that we would kind of shine the light on this amazing collaborative and task force and make it an excellent example for future trending collaboratives that will help to improve our county's overall health.
I think that deserves a round of applause. That is amazing, and congratulations. So you have to stay in touch, and, keep us posted. Is this something that anyone could attend if they wanted to?
Yes, it is an open conference. So obviously they encourage public health individuals in the field of public health, but it's definitely open for registration. Yeah.
So we need to have T-shirts made and a logo and a song.
In the crowd, yes.
Yeah,
That'd be great.
That is wonderful. Congratulations. We are thrilled. So keep us posted. Okay. And Darlene.
The hospital opened a new wing on July 9th. A lot of new diagnostic and treatment services, and one of them is a neuro biplane. And in a biplane room, we'll be able to treat brain tumors much more aggressively than basically anyone in this part of Southern California. So really excited to have that new service for the community. Also pleased to announce a residency program. So we'll be training physicians starting next year.
Yay, that is huge.
Yeah, new docs coming to the community, so excited about that.
Coming into the community and hopefully staying in the community. And we know that people who move here, move to the region, love it here. So I think our chances of hanging on to them are really good. So that is perfect. Well, it's a great news day. Okay, so then item number 3 is expansion of cancer services treatment assistance program. And Kim, are you going to do that? All right, Michelle's place. So if we have video, are we looking at video?
Yes.
So look at in front of you and you'll see 2 buttons. One says PC and one says video. And it looks like it's already going to be in front of us, so you don't have to do anything.
Today, I wanted to share with you the progress we have made on the treatment assistance program, which we shared with you at the last Cancer Task Force meeting. The Cancer Task Force also committed to finding a way to fund the program.
Are we waiting for the screen to change?
Next slide.
Hang on, let's see. Somebody helping you?
I'm in charge, I forgot.
Thanks, Kim.
I'm on it now.
That's okay.
The Treatment Assistance Program was developed to provide clients who reside or receive treatment in Riverside County with financial assistance towards their cancer treatment. There are many programs that provide financial assistance for medications and certain treatments, but most do not offer aid for insurance premiums and radiation copays. This type of financial assistance is a high priority for those in cancer treatment. This program will be available for all types of cancers, further servicing our community. For the first year, we'll be working with hematology oncology to ensure the program is properly established and executed. By working closely with the staff at hematology oncology, we can identify any changes that need to be made to the program. The advisory committee is an important aspect of this program. The committee will be compiled of local physicians, executives, nurses, and office coordinators that have a stake in the cancer care delivery in Riverside County. These are the individuals who know what resources are available and can help us determine applicant eligibility. We ask that those that commit to the committee attend at least 3 meetings, which will either be held quarterly or on an as-needed basis. And because emergency situations may arise where a patient may need a treatment resulting in $500 or less, Michelle's Place will be able to approve or deny these cases without needing to consult with the committee. We would like to thank the individuals who have committed to being on the advisory council. We appreciate your experience and expertise to help us help others. So far, we've heard back from Peter Baker, Cheryl Allred, Kathy Zapia, Darlene Wetton, Dr. Mendoza, Dr. Schinke, Dr. Segal, Dr. Horner, Dr. Hizan, Dr. Brebner, and Robin Granger.
Really good. Really good.
The following eligibility guidelines must be met. The patient must have a cancer diagnosis. The patient must be receiving treatment in Riverside County. The patient must be referred by their oncologist, and for the first year, that'll be hematology oncology. The patient must be undergoing active treatment, and they must demonstrate a financial need as determined by the medical office and have exhausted other financial assistance programs options. They also must be insured. We would like to keep the process as simple as possible. The application will be available in the oncologist's office. The office manager or designated office employee will speak with the patient, introduce the program, and have the patient fill out the application if they are interested. A completed application will have the application, the authorization for release of information, and an authorization for release of protected health information. The application can then be faxed, scanned, and emailed, or dropped off at Michelle's Place. The applications will then be reviewed by a Michelle's Place employee and, if completed, presented to the advisory committee for approval or rejection. This image demonstrates the application components. So why should we tap in? Well, we hear so often that people elect to not have treatment because they must decide between treatment cost or putting food on their table. Being diagnosed with cancer is overwhelming enough, and much less worrying about how one is going to pay for it. We would like to remove these as additional stressors, ensuring that no one in our community, that they get the help that they need, aligning with our vision that no one will face cancer alone. TAP will offer hope to clients who are in need of financial assistance for their cancer treatments, and all other options have been exhausted. It will also reflect positively on the cancer care delivery in the area as physicians, hospital executives, and Michelle's Place work together to provide a valuable service for our community. So what are the next steps? We need more advisory council members. So if you are interested in joining, please contact me. I left my business card at everybody's table. And funding, the big one. Michelle's Place anticipates needing at least $50,000 to start the program. And so far, all expenses have been paid by Michelle's Place. Questions? Yes.
Are there any questions? I have a couple. Does anybody else? So first of all, we can't thank Michelle's Place enough for expanding their existing services to reach out to address all cancer patients, which is remarkable. So Kim, I know that because of the red tape or the complexity of the paperwork involved with CDBG grants, that you guys hadn't accepted CDBG grants or applied for a while, and I know that we fund you through community service funding, but are you going to try and reach out for CDBG for this project?
Possibly. We'll see. The problem is with CDBG, it's you also have to, there are very strict parameters for people who qualify. And so because we don't have those same parameters for the people we serve, if nobody qualifies under CDBG, we can't use those funds for those patients.
Right.
So it's tricky, especially in a first-year program, to apply for CDBG funds for something like this. So the answer is not no. Down the road, if I have great stats and I have enough numbers that I can say it will work, then yes. But not for the first year of the program.
And I know that the regulations have changed because, through Operation School Bell, I'm with them all the time or talk to them. So there's always the issue of patient confidentiality, or, the HIPAA laws. And so I don't know if the CDBG requirements allow you to get around that somehow, or just provide a number rather than...
Yeah, so CDBG has a form that is mandated that the client has to fill out. And they have to do the big thing is income verification. So all they have to, provide tax forms and all this good stuff. So it's just another step, another hoop they have to jump through. And we do it for certain things. Again, for our financial assistance program that works well, these are people who are struggling financially and they don't have money to pay their bills, and they're obviously low income. So that works for, for some of the CDBG, but again, for something like this, it's just not for the first year.
Right.
They'd have to fill out another form.
My thinking was that you'll be serving people from the region, so you'll be
Right.
covering as many cities as you have with
Yeah.
Michelle's Place, but it'll increase your patient pool or your
Yes.
client pool to the point that maybe you would be able to
Yeah.
apply, so I just
Or
wanted
hire
to-
someone to just do CDBG grant
Yes.
reporting.
Yes, I mean, there's so much paperwork
There's
involved
so
in
much paperwork.
everything
Yes.
that everybody does now, that, with HR and all that,
Yeah.
that people do hire full-time people, so, we'll see. But
Yeah.
I think we can't thank you enough for stepping up to the plate on this.
course.
It's remarkable.
Thank you.
Is there anything that you want to ask us?
Well, we're not done, because we have one more thing. You're part of this, so you kind of know that
Right.
here's our next steps. Is that Michelle's Place is not only going to help all cancers with the financial assistance, but we really are going to expand Michelle's Place to be a support for all cancers. Our lease is up in our current building. We're busting at the seams in 3,200 square feet. And so we know we need to move. And so it's a prime time, I think, for us to not only move into a bigger space, but with that, meet the needs that are screaming at us for all cancers. I mean, the financial assistance is one with treatment, but we have cancer patients in our support groups, lung, pancreatic, you name it, all kinds. In our metastatic group, our regular support groups, people who receive wigs. So we've been doing it for a long time, but having actually saying it out loud, like you said, it's going to significantly increase our patient load. So we need the space to provide not only more breast cancer resources, but all resources, because there just isn't anything anywhere near us doing that for them. So we're going to try and do that for them.
I think if we go back to the screen that shows your advisory committee,
Yes.
I think that is a tremendous resource for you, and
Yeah.
they will be able to reach out to their vendors and many, many other resources.
I hope so.
To help you.
And if anybody can or knows any, but this is a pretty strong group of people in this room that can pull resources together, and many of you have. I'm a huge support. So many of you have supported us in so many ways. So we're going to lean on those current supporters. We're going to ask for new supporters. We're going to ask for help in all kinds of different ways. So I thank you all for that support that you've given us, but we have a really big project ahead of us, so we need help.
And are you looking, we know you need more space. Are you looking any particular place? Do you have any leads? You don't have to tell us what they are, just.
Right. No, I mean, honestly, whatever comes up. We would love 10,000 square feet is our ideal, because we need 5,000 just to meet our current needs right now. And then having another additional 5 to grow, but also ideally this would be an all-inclusive center, right? So this is a space where not only are we providing these support services, but we would give a place for other nonprofits to come and have a Temecula or Murrieta location or whatever location that is here that we refer out. We refer out a lot for financial assistance, senior services, mental health services, and to have those people in our center renting space would not only help us with rent, but we could then just, our clients can go right next door and receive services that we're having to now call out.
So it would be great to have a turnkey.
Yeah.
Yeah,
So
all
10,000
this in
square feet
place.
would be ideal.
Okay, so now we've all heard that, so we're going to keep our ears open for any benevolent property owners or developers.
That's what you got to do, right? You
Yes.
have to just put it out there.
Yes. So,
That's what
okay,
we're doing.
wonderful.
Thank you, Marion.
All right, thank you. No other questions or comments?
I have one question.
Go ahead.
Just Kim, can we get a copy of some of these slides sent
Sure.
to us? So if you would like me to make a little presentation when I meet with my city council members?
That'd be
So
amazing.
spread
We
the
can
word.
shorten it out a little
Yeah,
bit.
that's,
Can
shorten it up.
condense it.
I wouldn't use all the slides,
Right.
but there's some key ones that I would like to be able to share.
That'd be great. I will
Okay.
send that. Thank you.
Thank you.
Great, thank you. Okay, so we can move on to the follow-up items, and I'm going to change the order just a little bit, and let's go to the outreach work and final steps, so that way we can see what we need to do and see what our schedule may be.
Right,
So Betsy's going to talk about this.
great. So if you remember, we met in January, and HARC provided some of the, the top 4 issues for our region regarding cancer healthcare is lack of awareness of our resources, perception of a lack of prestige care, physicians shortage, And we also discussed the shortage of medical tech staff that goes along with that. And the fourth top issue would be cancer treatment is basically financially burdensome. And so thanks to Michelle's Place for stepping up for that issue. Then the task force discussed a number of follow-up tasks that, and it primarily had to do with outreach and how we can communicate that, yes, we are a region of wonderful cancer treatment options, and how do we change that outlook? So we went back to the drawing board, staff did. We took our resources and we actually applied for a fellow intern. WRCOG is coming to the table with an intern that starts at the end of this month. It's a little bit delayed, but in the meantime, I did have some support gathering additional resources, and Julie Reeder of Reader Media has stepped up to do some fantastic work. So I'll just go quickly through our accomplishments and our final tasks to finish up this task force and all the tasks that are involved now. So if you remember, we do have some wonderful accomplishments. We have secondary data analysis report done by HARC. What do we know about cancer in the region? They also did a cancer care community health assessment, provided infographics summarizing the data about cancer in our region. And this information really is intended to provide the medical community here understand the need of what services are lacking, and hopefully the medical community can take these reports and fill the gaps that might be lacking in our area. But what can staff do to help? Staff, we can circulate the information to the healthcare and medical community, including hospitals, clinics, oncologists inside the region and also outside the region to attract more services to our area, and distribute it locally and regionally to corporate offices of large cancer care centers to maybe attract them to our region. So that's what we can do with the information that we received from HARC. Feel free to step right in if you don't agree with that approach, and that's this is our game plan. The next slide I have here is really important. We've already started the draft outline for, not fro, the magazine and publication that Reader Media is putting together. And this is entitled, for now, Southwest Riverside Cancer Resource Guide, You Have Cancer and What to Expect. This is an amazing, over 100 pages. We sent an outline of the magazine to each of you. If this magazine is successful, what they're going to do also is weave in all of the resources. So all of the resources that we've been working on over the past year, it's a list of resources. That's the second bullet point here. But all of those resources will be folded into this magazine, and if it's successful with, it'll be electronic, online. I'm going to have Julie speak more to it, but I'm just giving you a brief overview. Then they can do it potentially annually if it is a success. And every year there'll be this magazine electronically and also distributed throughout, where they can have there's opportunities for all of the task force and the medical community, the members in the medical community, to provide advertisements, advertorials, articles. It's quite an undertaking. So that is an accomplishment in the works, and we will have our intern from WRCOG assist Reader Media with this big undertaking. And that's just sort of kind of a spread of what it'll look like. It's a professional magazine by, awesome. I mean, amazing. Several organizations throughout this process have had some definite achievements, and maybe there's more that the task force and we can do to outreach about them. Like Loma Linda is a national accreditation as quality accredited cancer program that happened during our task force. UHS, Temecula Valley Hospital, and their residency program. The abstract that Salome just spoke about, Michelle's Place expansion of services, and there's probably others that we just don't know about, that are having small successes that we can help promote the information and work with each of you to make sure it's included in the magazine. Maybe we're going to develop the Cancer Taskforce webpage. There is one, but the intern will just kind of develop that to be a little better, and other avenues of PR. Michelle's Place just gave a very good overview of their expansion of services, so that is an accomplishment. Of course, the final tasks here is they need volunteers to be on the advisory committee and obviously funding. We have in the audience here a few of our future physicians, and Dr. Hizan as well, who is trying to cultivate hometown students so that they can return to the region as physicians. And this, goes to, we have a shortage of physicians, so what better idea than to cultivate our own hometown kids. So at this moment, Temecula's Future Physician Program, I'll probably give this over to Dr. Hizan. I'll keep the slide. If you have a slide, I can change. You do.
Introduce yourself, please, since you missed the self-introductions. And you have to push the little red button. You have to push it hard because it's electronic. So.
Okay. Hi, Jerry Izan. I'm a family sports medicine doctor. And so I've been very fortunate to be involved with this program for the last 5 years. So the Future Physician Leader Program is sort of a three-pronged approach with the new Riverside, UC Riverside School of Medicine that started about 5 years ago, the Temecula Valley Hospital, as well as the city of Temecula. And so the goal is to cultivate homegrown talent. And this year we have about 45 that are in sort of all the programs. So on Mondays we have a high school program. So we have folks who are interested in the high school level to just learn about medicine. It could be any number of things, not just being a physician. It can be, all the other specialties and occupations in medicine. So that's sort of getting them interested at that level. On Tuesdays, we do the college pre-medical program, and they're from all around the country, but they sort of from here. And so we have different speakers. Just this last week, we had Dr. Bremner and Dr. Gorski give their talk. And so it's sort of allowing them to learn about what a physician does. Dr. Adam Malik, a lot of the really good physicians in the area have stepped up to do that. Wednesday, we have what's called our outreach community projects. And so one of the ones, there's a lot that are going on, but one of them is to come up with a website, iecancer.org. And it's going to dump all the resources and research that's being done, the best YouTubes, all of that. So that is going to be directly from the physicians or from the students. And then on Thursday nights, we're finishing up today our fourth medical scribe program. So there's a medical scribe certification. The city's been very good about getting them medically scribe certified. We'll help them get their internships, and they need 200 hours of that. And we've already had, in fact, Charles gives his regards and said that he got pulled over in the hospital because one of the students from last year who took our course directly got a job because of the course that we gave them. So these are folks that can get a job sort of right away. They can be in the emergency room or in local clinics, but it gets them, it's a very good pathway to get them into medical school. So we've had some very good success in that regard. But we also started a iemedicalscribe.org website that will allow other people who are interested in getting into medicine to actually take the course online for free and then sit for the test. And then we can help match them with their internship. And so all of these are things that we are starting at the beginning to get them interested. We will probably this year have a somewhat medical scribe program in the high school level. So starting in about sophomore year, you'll start doing medical terminology and then sort of have that. Because if you look at it, each doctor needs about 3 or 4 scribes. There's none to be had. So this could be feeding at that end. Then on the other end, we should, as we mentioned, have a residency program started in July. Possibly, rumor has it, I don't know how much I'm supposed to say, but tell me, Darlene, if I'm overstepping. We should have like internal medicine and family medicine. And so we'll have residents that will be from this area. A lot of times they'll stay in this area. And then just starting August 1, I'm one of the faculty for the Sports Medicine Fellowship out of UCR. So we're starting to get graduate medical education that'll be in this area. So our goal is to sort of have it on both ends. let's cultivate them. If you have interest, we have a need. We're a medically underserved area. On the other hand, once you get to medical school and residency, most people will sort of work within the area that they are. And so it's getting very exciting. Besides that, there's community outreach programs as well as some other educational things. So the future looks bright. We'll keep working hard, but really you guys should be very proud of the students that we have in the Temecula Valley that are really stepping up. And this, nowhere else in the country are they doing this sort of thing. So I really appreciate the hospital, the city, the medical school, and it's really sort of a nice synergy of all of those. Thank you.
Great. Is that a program that we can share the curriculum with other cities in this region, or is it for all cities to come to
I think it's
your
absolutely,
program?
yeah. So they are videos of me, so I do have a face for radio, so you have to like give that thing out. But it's a four-part medical scribe course, and then from there is actually, and it doesn't cost that much to be scribe certified. It's about $300, and so they get that. It's a national certification through CMS for Medicare, and so they're scribe certified. We can help them wherever they're at to get their internships, and then they can get jobs. And these are, not the greatest as you start, but then can go on. The other thing I did have a slide of, and one of the sort of programs that we're looking at is, let's say you are a high school student and don't really have a lot of resources, you really can't go to college, but you want to get in the medical field. What we're really trying to push for is something called a medical assistant scribe. So a scribe can kind of like take down stuff, but they can't really do anything with the patient. An MA can do some things, but they don't know how to scribe. So one thing that you could do is and this is my vision, is we teach them how to become a medical scribe in high school. You have to understand, these are all smart kids that are computer native, and if I have my phone having a problem, I give it to them. They figure this out.
Yes.
So FOM, fat old men like me, we have to learn stuff, whereas they're like, it's automatic. So they know the computer, they can get pretty good. From there, then once they're a medical scribe, if they work in a doctor's office for 2 years, you can then sit for the MA board. So going to an MA school costs like $15,000. But if you can get a job as a scribe, work in an office for 2 years, start to learn how to do it, then you can sit for that test, and now you're an MA scribe, and there's jobs everywhere.
Awesome.
So we're very excited. It's a lot of work, a lot of folks. There's Logan and, blanking on your name, sorry. Devin. So we're very excited, and they're students themselves. So we're all frankly, we're very impressed with the quality of students that we have, the support from the city, the hospital. It's getting good. We just have a lot of work to do, but our goal is to improve access to quality health care, ideally in a culturally sensitive manner, so they could take a medical Spanish certification course. So all of this is going to allow us providers to focus on patients. We still need our documentation, but we can really focus on the patient. And I think with this sort of strategy where we're sort of having all of the synergy together, it could be very exciting in the future. It's already paying dividends, but we look for it to really become scalable. So thank you.
Good, Betsy.
All right, yes, so we are cultivating our hometown students, as you can see. And we would love to share any of the information and outreach through our avenues of maybe there could be something in the magazine about this project as well. So one of the discussions by the task force also, how do we attract new providers and retain our existing providers? And that includes outreach. So we need to promote the region and its excellent, hospitals and cancer services through this magazine and the publication. We'll also promote this publication through that it's even here. There's a series of e-blasts and press releases and webpage links, social media that we can share with all the cities, and they can share on their social media. We're planning to develop a brochure, which could also be electronic. So if each city could design an ad about their amazing quality of life in their city and their lifestyle to attract prospective physicians, we can share this with our Economic Development Coalition and our individual economic development divisions to disseminate because that is there, we all have a division that tries to attract jobs, and that includes physicians and medical services. And for our final meeting, I think it was Dr. Hizan, I'm not sure, but there was a discussion to have a meet and greet, and that could be with our local medical office professionals, and also maybe invite outside the region to create, you never know, venture opportunities. But if we could do a medical meet and greet, we can host it here at the city of Temecula, in our conference center. And I did want to go back to, and again, the next two items on the agenda are the magazine and the resource guide. But for the magazine, we are not staff here is not the medical experts. We can't write the articles, and we need that input from all of you. And so we're looking to form a subcommittee for the magazine itself, and also for the resources. Because if you look at the resources, you all might know that we've forgotten XYZ, or in your circle of professionals, there's also this other, or perhaps part of your own company. We just want to make sure that we're not forgetting any resources. So a subcommittee for that, and the communication can be all via email. There really won't be too much staff is going to take on this workload. We just want to get your expertise. So not only on the outline of the magazine, but also on the resources that are going to be weaved into the magazine. And then I will conclude this presentation with our final tasks. And then the next meeting we had scheduled on the books, it doesn't really make sense for an October 11th meeting. So we propose by February 21st, the magazine will be done. We can have it there at the meet and greet, and we can host one of those for hopefully, and if this magazine is successful, it can be an every year thing. The resources we'll give to the American Cancer Society, as well as the resource electronically in our Riverside County resource guide electronically. But I know Reader Media will have it electronically as well, and if it is successful, the resources will be renewed every single year.
So does anybody have any questions for Betsy or for Dr. Izan? You, Darlene?
Yeah, I think a real important contact is going to be the City of Hope, because the City of Hope has acquired the radiation centers in Temecula.
Oh my goodness!
And in Wildemar, so they are coming to town in a big way. So I think they'll be a key contact to include in the article, and perhaps support of Michelle's place, those kind of things, because they're going to want to do a lot in the community.
Wow, that's news
What's
to
the
me,
time?
and
Yeah,
definitely
what's the
reason why we
timeline
need
on
your
that?
input.
Darlene, do we know when? Oh,
Yeah,
that's
they're already here.
awesome.
They've already acquired. That's already official. So they're just going to come and now start adding more services to the community.
Wow, and are they aware of what we've done on the task force? Oh, we need to meet with
Probably
them.
not.
Yeah, yeah, we definitely need to meet with them.
They are, Marianne. 'Cause
They are, okay.
Dan Ayer, who works for McKesson, is who City of Hope is acquiring, so he now works for City of Hope, so he knows everything that's going
Oh,
on.
and he's on the contact list. He's been getting all the emails. That's great.
He's been to these meetings and knows.
Oh, wonderful, okay. I have one question for you, Dr. Izan. I know I heard IE as your prefix for websites and things, so we've kind of been trying to get away from IE. I know you probably already have that maybe set in stone. People envision, because it's, between San Bernardino County and Riverside County, we're larger than most of the United States. And so we're trying to kind of develop our own identity.
So is it Silicon
No,
Valley?
probably not. I can tell you,
Info Valley? What was
well,
it called?
the County of Riverside is doing a new branding and marketing program, and they're going to be using Rivco. And if we want to, make it smaller than that even, but we will probably be treating people from Riverside County, from greater parts of the county. So I just thought I'd throw that out there. I kind of have this pet peeve with people who use IE because it gives a whole different vision of what the area is and does and may look like. So I think we want to just allow San Bernardino County just to have that identification and.
Okay, Whatever you want.
If it's not set in stone yet.
No, but you could have multiple ones too that do lead to it. So.
Yes, right. So I just wanted to throw that out there.
Okay. Yeah, because we have like a whole family of them, so let me know now.
Okay. Well, you know what? You and I will talk, and we'll see. So, but great job, Dr. Izan. Okay, Julie, go ahead.
Okay, well, we are hot and heavy in the middle of this. Kim has been working on it with staff, has already given assignments for writers. And of course, again, they're not medical experts, but they are planning on actually writing the stories so that we don't have to worry about the doctors having to actually write the stories.
Probably good.
So they will be reaching out to different people for resources. And the idea, as it was presented to me a year ago, was that we would put this magazine together and that we would try and self-fund it with advertising and advertorials and all that, which we will be reaching out more to the community for that. And then it would be a resource that's given to people that have been given that diagnosis so that they have some direction. And I know from other family things that's been helpful in other areas to be given a resource. So when we're calling all of you for advertising, you have to make sure you take our calls.
Well, and this magazine will be something that people keep too.
Oh, sure.
So it will.
Yeah, and we'll be able to redistribute it throughout the year, just like we do our other source books and all that. I was going to say that's so exciting what's going on with the high school and those programs that you're doing. And I'm wondering if, to the point where you're trying to draw people, new doctors, to the region and all that, if it would be a good idea to have some stories. I know there was a young doctor I talked to at the last meeting, that surfs and skates.
Yes.
Right.
Yes.
Yeah, Dave Horner. Yeah, he
But
does. He does skates.
maybe it would be fun for the paper just to do some features on those doctors and their lives here, which would be available online if anybody was researching the area.
And he has
They
a
might
cancer
find
story. He's a cancer patient.
Yeah.
So.
And he skateboards in Menifee at our bowl there.
Yeah.
Yep.
He's a character.
Yeah.
He would be fun. He'd be fun to do a podcast with. So anyway, so I'm just.
Also, just to add, there's Kyle Vinson, who's a new family doctor in town, and I was his team doctor when he was playing high school football.
Oh my
gosh. And now he
gosh.
finished his residency and he's working here full time at Temecula Valley.
Yeah,
so.
see, those are great stories. People love that. So anyway, if we could just if you guys could connect with Kim on those things, we love those stories, and that would be helpful. So that's about all I have.
Wonderful.
You have any questions, anybody?
Just one question, actually. Should we form a subcommittee? Is there anybody here, or, I mean, we're missing some people that want to be very involved in the outline of the magazine for input, or would you prefer that we just reach out to everyone, and if you have any concerns, you would just let us know? What makes sense to the task force is fine with us.
So, Julie, you need people to be resources, right? Resource for donations, resources for stories,
story.
resources for everything. Yeah.
Yeah.
Okay.
Can I address that comment about resources and task force?
Sure.
If that would be okay? I like the idea of having a task force or a subcommittee to help with input, but we also are going to get to a point to where that outline is going to have to be set in stone, and everyone should have that outline. So you should look at that over the next couple of weeks, and if you want to make changes, get back to us, I would say, by the end of July.
Perfect.
And I think that that's the best way to handle that.
Okay.
As far as writing stories goes, the way we're trying to do this is in order of that table of contents. So the stories are assigned out. We're trying to bring them in order of the table of contents, which is on that outline. So take a look at that. Everybody should have a card from me at their seat. If they do not, make sure you see me before you leave. And please reach out to me when you look at that table of contents, because we do need sources for these articles. I, too, am a cancer survivor. I had breast cancer and brain cancer. I've had 2 brain surgeries, a bilateral mastectomy. am I a pro on cancer? I know my journey and what I went through, but I don't have half the information that our medical community does. So you are very crucial to this being a successful guide. So please reach out to me, look at that table of contents. Our task force, I really want to give you the opportunity to be our first chance to be resources for the different articles. Everything from the beginning where we talk about what is cancer, what the types are, the cause and effect, all the way down to getting second opinions and how we would handle that bad news should bad news come around. You're crucial to that, to making this a success. So I really would like you all to take a look at that. Please shoot me an email. That's actually my cell phone number on there. So you can text me if that's easier for you and reach me pretty much anytime on that phone unless I am asleep or eating.
Just turn it off. Just turn it off.
Yep. So at those, you have that information. If you don't have that card, please see me on your way out and let's have a brief chat. And I really do like the idea of doing stories on your program that you have going. I think that's a great idea for the paper. And that's all I have.
Julie, so we're good?
Yep.
All right. This is a really great meeting because we can look back and see everything that's been accomplished, and it is remarkable. Solomon, are you getting all this for your oral presentation? Oh, my goodness.
I have it all. I've been through the whole journey. So
Oh, my goodness.
It's all up here.
Yeah, I hope they're giving you like 4.5 hours for that oral presentation. Okay, so the next thing is cancer resources and services. And who's doing cancer resources and services?
Okay, so that's the resources that is going to be folded into the magazine.
Oh, okay.
So, but again, we'll be reaching out to all of you to take a look. Make sure you're on it. We could have forgotten you. I mean, there's just, it's really important that you take a look at those resources because that will go into print. And if we don't want to forget anybody, it's human error. So once it goes into print, we can always fix it maybe electronically, but and hopefully if it's you know, a success, we can change it the next year, but it's always scary once it goes into print. So
Right.
please look at the
And
resources.
also, too, we were hoping to go to print in December so that we could have a January 1 distribution, so, for
That'd be good.
2019.
I didn't take a look at this yesterday, but I went to the ribbon cutting for the new imaging center on Di Portola in Temecula yesterday. Beautiful new PET CT, new mammography. I mean, so there's a lot coming to South Temecula that just
You know about
just
those,
opened,
Kimberly?
so-
Okay.
Okay.
Just
I
checking.
wasn't sure if they were in the publication as resources or not.
Either.
Like
So what is the name of that?
Under RadNet, it's Advanced Imaging Services
I'll get it
on Di Portola.
Okay.
In December.
So if we know of resources or additional resources that are not on that list already, then we need to make sure that we have those.
Yes, and I'm going to ask each of you to email me those names so that I
Okay.
don't forget to make sure to give it to Julie. Yeah, thanks.
All right. Okay then, so we've already covered the cancer resources and services. So before we adjourn, does anyone have anything they'd like to add or make any closing remarks? Anyone?
There is
Dr. Izan?
food.
If I
Yeah,
could.
there's food out there, so.
So just so you know what I'm doing next week. I'm real interested in the nutritional aspects of cancer. Cancer has some metabolic weaknesses. It only ferments glucose. We're hybrid cars. We can run off of ketones or glucose. So there is a lot of interest in looking at the nutritional aspects that are available to augment, not to replace, but augment chemo, radiation. So I had presented at a tumor board and bought the books from a book called Keto for Cancer for all the oncologists. And then I'm going to meet the author next week. Oh, cool. So she's been very interested in what we're doing, you know, and it's been very good because I've already had patients that I've sent to the oncologist and they kind of know what I'm doing and these sorts of things. So very exciting. If you get a chance, you might want to look up, and that was one thing I was going to show, was a keto pet sanctuary, where they actually, out of Cedars-Sinai, send dogs to this place that are from kill shelters that have cancer, and they actually get better. They actually have kind of a contradiction. They have a dog CAT scan. I thought that was kind of weird. But they have a dog CAT scan, and they're showing tumor regression with a combination of a well-formulated nutritional program with hyperbaric chambers. So again, very exciting sort of proof of concept things. This author is pretty remarkable, so she's knows what we're doing. And so it's some exciting things, and maybe the next time I can tell you sort of how that goes and those sorts of things. So
Can you talk to her about being a resource for the magazine, perhaps?
yes, I think she probably would.
That
But,
would be great.
Yeah,
Yeah, that would be great.
so just to let you know that part.
Okay, thank you, Dr. Izan. Does anyone else want to add anything or talk about anything? So Betsy, what was our October date? I mean, our February date again, the 11th?
February 21st.
21st, okay.
If that is, it's a Thursday, we're looking at 4 PM, kind of the same. And then it would be in the conference center. I've already actually reserved it because that's how far ahead you have to reserve it. This is why we
Yes.
are in this meeting room today.
Well, we're happy to host. I can't say enough about everything that's been accomplished through the hard work of everybody that's involved. It's amazing, and the fact that we were selected, or this subject was selected for that special presentation is great too. So be sure you let us know, and we'll see if we can get a cheering section together
Sure.
to go with you.
Just be ready in November.
Okay, we have every reason to be very, very proud, and staff members, thank you all. Everyone, thank you so much. We've come a long way, and I think the Valley and Riverside County in general is going to benefit greatly by all the resources that we've identified, and now with the programs that we're establishing, all the new resources that we'll be able to attract. So I can't thank you enough. I think we ought to give ourselves a big hand. So with no objection, we will adjourn this meeting to February, and let's all stay in touch. Thank you. Wow, that's amazing.